I'm speaking to you here from the 2022 ASCO meeting in Chicago, and I've been presenting some results from a UK investigator-sponsored study called ATLANTIS. This is actually a platform trial in patients with advanced urothelial cancer. So that's essentially metastatic cancers arising from the bladder and surrounding structures. And it's a platform trial. Fundamentally, the purpose of the trial was actually to try and explore biomarker-directed randomizations, and indeed we presented some results earlier in the year from a trial of rucaparib in patients with DNA repair deficiency aberrations. But this is actually an embedded randomization between cabozantinib, multi-targeted tyrosine kinase inhibitor, widely used in the treatment of particularly renal cancer, versus placebo. And in fact, this is in the patients who did not have any of the other biomarkers of interest within the ATLANTIS platform. So it's essentially a trial for the biomarker negative population. Patients undergoing first-line chemotherapy for advanced urothelial cancer will be tested for the biomarkers during the chemotherapy, and at the end of chemotherapy, if there's ongoing clinical benefit, that is, other than disease progression, would then be offered randomization into one of a suite of randomized placebo-controlled trials according to their biomarker status. So in this trial, patients who have no positive biomarker essentially randomized to cabozantinib or placebo within 10 weeks of the last dose of chemotherapy and continue until disease progression, the primary endpoint being progression-free survival. It's a negative trial, no difference between the two arms of the trial in terms of progression-free survival as a primary endpoint, and indeed the secondary endpoint of overall survival, no difference. Cabozantinib is a multi-targeted tyrosine kinase inhibitor, but undoubtedly its key targets are vascular endothelial growth factor receptors. And of course, this is yet another trial. We've now seen several randomized trials of VEGFR inhibitors or VEGF-targeted therapies in urothelial cancer. Some hints of success, but really overall, they've all been fairly negative to date. Importantly, in this context, which is the maintenance setting, of course, there is a new standard of care, which is maintenance immunotherapy. So there is actually an ongoing randomized phase 3 trial of avelumab plus or minus cabozantinib in this setting. The question is what is the future of vascular endothelial growth factor receptor targeted therapies in advanced urothelial cancers? And I think fundamentally what's really important is that we now need to try and find selection biomarkers. We need to be able to identify which patients, if any, are going to benefit from this treatment, because it's increasingly clear that simply giving all the patients these drugs it's not delivering any significant clinical benefits in really quite a large number of trials so far.